if I had. I'm sure we'll pick it up as you guys really jump into doing this, and then I may interrupt you every now and then for this is my, it's not timeout, it's teaching moment. Okay, so here's what I've got on the plate for you guys today. You're an adult program, correct?
Correct.
Okay. Little caveat for child and adolescent programs: if you're a child and adolescent program, anytime it says individual, you say child, adolescent, and family. Okay, that's the only caveat. So we'll use adult program language because you guys are an adult program. I have selected out some questions for you guys to grapple with, and there's only a few of them. Okay, and I'll tell you what they are, and then I'll get you guys to actually do the procedure. Now, the hardest thing in doing this from this moment forward is when you guys talk, you have to like talk to each other. You have to kind of forget that I'm here. Okay, I'll be interrupting you, so it'll be kind of hard, but this is your conversation, not directed at me. Okay, so being a believer, and start with the first step. I'm going to start you guys with the first question. The first question is on page 1. How about that? Okay, so it's under section 1, program philosophy. Okay, and so you guys face each other. Paul, I'm going to get you to go ahead and read the question, and then you guys go for it, and just be yourselves, and it will be great.
Okay, under section 1, program philosophy. The program operates under a written vision, mission, or goal statement that officially communicates to all staff and stakeholders the agency-wide goal of all of its programs becoming welcoming, recovery-oriented, and co-occurring capable. It's like not at all, or slightly, somewhat, mostly, or completely. And to start, I guess, I would say that I would say mostly only because that you have to build a rapport with your your stakeholders and people that are involved in the spectrum of treatment, and so we have to build a rapport with the people in the satellite programs that we work with, as well as our clients. And I think that's what this is saying. Anybody have to talk about that?
Well, I think we've definitely moved forward in the welcoming area. I think that was a challenge a while ago, but I think we're certainly moving towards that, as well as being more recovery oriented. I think that we try to speak about all of our clients from that framework, and we try to come back to that when we get stuck in areas that aren't recovery oriented. We try to bring in reminders about how people are making successes in their lives and that they're moving forward. So I think we do a pretty good job of that. What do you all think?
So you give us a 4?
Well, I don't know. I didn't give out a number yet, but I think I think our co-occurring capable. I think that's a challenge for us in some ways. I mean, we have a lot of our clients are, as Chris was saying, very complex. I mean, I think that's just a big struggle, and I don't think we have come up with the actual answer to that. I know we constantly work on that one.
I do think we have become more conscientious of that.
Mm-hmm.
And, I think we have started the conversation of being more welcoming, and it has, I don't know, I get the sense that we're doing a good job and we're moving towards a 5,
Mm-hmm.
but certainly there's a lot of room for improvement. At least I think that we will try
Mm-hmm.
at some level to welcome our clients.
You know what I'm wondering now, if anybody remembers the mission statement, which we worked so hard on a few years ago.
So that was before.
Yeah, and obviously it was before Linda Beth's and Paul's time too, so I don't know if you've even been privy to it, and I can't remember it very well. So that might be something to think about. Does that mission statement still apply? And should we have it posted somewhere?
Yeah, I was thinking, I've never seen anything like that.
No, we did do that at one of our retreats, right?
But we didn't get it posted.
Oh, I didn't.
Yeah.
Right.
Well, roughly, what was, because I haven't had an opportunity to read the mission statements, but what roughly is it?
And that was before
Doesn't
Chris's
tell.
time. Do you know what our mission statement is?
Well, I wrote a draft one when I first joined the team and sent it around, but that was 3 years ago. So I think this discussion has brought to light that does need to be discussed again, certainly when new folks come on to the team and re-upped and clarified.
And shown to the clients.
Yeah.
Yeah, it's a good
Post is really good.
That's
So what is it?
Well, isn't it written on the pamphlet that we initially give to the client when they, on the initial paperwork, when they come in and?
Is it?
What is
No,
it?
I think
it's
so.
not in
No?
the policy, no. Well, not in our assessment packets. No.
But
But that's a good place.
it encompasses the welcoming and that we are recovery oriented and that we address, issues that are, reoccurring things. Does our mission statement encompass those areas?
Well, I don't think I have read it in a while or if ever, but
I don't remember.
But I would think so. I know that we have made it a focus to say we want families, we want to help the family. We don't just see one client as an individual entity as opposed to the whole family. And we reach out to the family.
That sounds pretty complete.
What's nice about this program is that the original core foundation of it was to address these. And so the program was actually created with this question in mind from the very beginning. So I think, this is a good group to actually start this training because we already sort of have our ears and eyes open to.
And I know when I meet, I don't know if that directly answers the question, because I'm cognizant we have to answer the question, but I know that when I meet with potential new clients, when I describe what is the Odyssey program to folks when they're in the hospital or they get brought in through our outreach program, I do talk about that. I do talk about the fact that we are, very recovery oriented, and describe sort of all the different facets of who we are. And describe recovery as the process. And that, when you show up today, maybe it looks a lot different than when you're done with our program. Or, so I think that's one of the things I try to communicate, even when it's someone who's on an inpatient unit and they're might be still struggling with an acute episode at the moment, so they might not take it in. But I like the idea. I know we're not supposed to fix problems, but I'm writing notes. There's an action plan thing down there. In terms of, making sure that clients know that. If we were to go poll our clients, so what's the Odyssey vision statement? Would they know? I think that's a good question.
And I think the people that we work with and that we interact with, the agencies that we interact with, they also know that, we're welcoming, because we get, quite a few referrals from, different agencies, and we're highly respected in this area. So I think that if they didn't see these things evident in our agency, that they wouldn't be as cooperative as they've been, and supportive as they've been. So what are we thinking here? Maybe I said a 4, but that's just my opinion. And Alomar said, we need room for improvement. We could improve that area. I think that's correct.
So Paul, just a teaching moment. This is a great time to say, well, let's just read the question again and make sure this is the question that we're actually answering.
Okay. The program operates under a written vision, mission, or goal statement that officially communicates to all staff and stakeholders the agency-wide goal of all of its programs becoming welcoming, recovery-oriented, and co-occurring capable. I really believe that the question was really addressed, and I think it was answered. I think we understand, we are welcoming, and we do express this to our clients and the other agencies that we work with. So I think we were recovery oriented, and we said that we have included that in our mission statement. That our mission statement encompasses these things.
We just need to find.
We need to find
that.
So, on that note, I'd have to give us a 3.
Okay.
I see room for movement.
Okay.
That's my
And it should be posted on every person's door, so they can read it every morning as they walk through the door.
At least in our conference room.
And so your
Everybody
number,
should know about it.
one thing to do is to go around in a circle and say three,
Numbers.
three,
Okay.
or however.
3?
I say 3 too.
Yes, I agree, 3.
3 also. I agree.
3.
Okay, well, that's just. I give it a higher rating at first because, I think that, we've been around for a while. And I think, this is mostly what we're pushing, but if you see room for improvement and you see where, things can be, done, more advantageously for our clients and the agencies that we work with, then yeah, I would agree with that as well.
So, round of applause, guys. Very, very good. Excellent, excellent. So, just in that little conversation over this one question, I mean, there's something that's starting to blossom out here. And just wanted to take just a couple of seconds to illustrate some things. You know how the conversation went to, well, this is why we are, right? We were created in this image from the beginning. This is what we're about. We actually are trying really hard to actualize that vision, and people know this about us out there. Okay? And that sense of, this is good. This is really good. On the other hand, we have a mission statement. Well, we have a draft of a mission statement, but I've never read it. Am I ever going to see it? So there's this tension between what we do and how we're built. Okay, and so this is one of the things that's actually the target of this Compass conversation. Is it looks at the design of the program. Okay, and so one of the key features about this question is that the program operates under a written vision, mission, goal statement that officially communicates to everybody what we do. Okay, so if you're looking at the intent of that question, it's actually a piece of structure that programs have that they operate under when they're in the co-occurring complexity capability business. Okay, so you guys illustrated that tension really nicely, and the thing to realize, and I think Paul, you wrapped back around it in your concession from 4 to 3. I think that what you're talking about is, it's really a wonderful thing to be able to say, we have it in front of us. Our eyes and ears are open to this, and we do have lots of opportunities to make it even better. And that should actually make us feel good, not bad. Okay, and so that's a beautiful thing. You did a great job. Great job. Okay, now let me move you to. I'm going to move you to page 2. Okay, and this is this question, I guess, number 3. Okay, and Julia.
Read it?
Yes, please.
Clinical record-keeping policies support documentation of integrated attention to mental health and substance use issues in a single progress note and in a single client chart or record. In my experience, the notes do track those things for me. So I would say mostly 4.
I hate to be the one that always says but. I think I
Change it to A.
I'm the one that says but. I think that the program that we use has real limits, because I think it was set up more as a billing tool than as an actual clinical tool, and because that's a whole CMH-wide program, I don't know how much flexibility we've had. I've had a great deal of difficulty with the artificial kind of separation between physical and mental health and charting to that. And especially when we're doing appointments with primary care, and I'm doing liaison work between primary care and psychiatric care. I would just say that's difficult, and I've tried my best to figure out a way to do that within the constructs of that program.
So what number would you give Luann?
I'd give it a 2. For my particular, I don't know that you all have the same
Yeah.
difficulty,
Mhm.
but.
You know, Eileen always tells us, you know, always emphasize on the psychiatric, you know, disability rather than the physical. Yeah. So-
And I think that's for billing purposes.
Yeah.
Mhm.
Yeah, because with the clients, we have a client with primarily substance abuse problem. We can't just focus on that on a session or a visit. We have to include some psychiatric symptoms. And I think that's for purposes of billing,
And it's the
right?
same thing with the medical, you know,
Right.
when we're dealing with.
Well, that's why the clients are in our program, is though, because
Right.
of their psychiatric
So you have to
disabilities,
do
they're
the
unable
linkage.
to, take care of their substance abuse needs or their physical health needs. So
Yeah.
we do have to incorporate that in terms of why we're engaging. I mean, why is it that we do that versus their friend Aunt Sally can take them to an appointment? Why do we need a mental health practitioner or
Right.
senior peer case manager? or
And I
nurse
tried my
practitioner?
best to make
Yeah.
that clear in the notes, but
Mhm.
there's a difficulty fitting it into the little boxes,
Mhm, yeah.
which often don't apply in that way.
But as I was hearing the question, I was also hearing, and I think all of what you said is accurate, but I also was hearing that there's, do we talk about all those different aspects when we see a client? And, you know, one of the things that I see in the gateway is that, you know, we have the objectives on top. So ideally, you know, the objectives reflect why you're there visiting the client. So you could say, okay, today I'm seeing Bob, and, you know, Bob, are you drinking today? You know, so you're hitting that piece as well as, has he taken his medication? So, and I think that in the recent past, certainly the substance use has become much more integrated into our treatment. I think in the past it was, okay, they've got a problem and, you know, they need to go deal with it. And we don't really touch that in terms, because we're mental health providers. But I think we've come a long way as a team and a system to really say, no, that's part of who Bob is. He's got this mental health issue, and he's also got the substance use issue. So,
And he has diabetes.
and he is, well, absolutely,
Yeah.
right. And so, you know, we need to get him to see the MCC clinic. And
Yeah.
I think I would ask the question through the point of view of another team that is trying to access information about our client.
I think
And
that's a
what it
great
would-
point.
What it would be like to go into Gateway and try to access that. And I would second what you're saying, because if you're wanting to get a whole picture, you literally have to click in and out of notes. And it would be really nice if there was a connection point between your note and my note, without having to click in
Back and
and out
forth.
of it. Of course, this is an administrative issue, so
Right.
it's beyond the purview of this question, but
But-
just in case any administration is listening.
But
Well,
if you want to read the chronology, you just start like at the bottom of the page and you read each note.
You can only bring up one at a time.
Yeah, but
You can't do a thing
but you
that
do get
says-
the different
Yeah.
practitioners' view if you go through systematically, chronologically. You will get that view. It does take more time.
Yeah.
I think that's where more is gonna come in handy too, just put that out there, but,